So I'm an American moving to London, and I am going to expose the U.S. healthcare system and the insurance system. It's about 370,000 people file bankruptcy every year because they can't afford their medical bills. Now, about 75% of those people have private medical insurance. So how does that happen? Well, I'll show you. This is an actual bill that
Somebody asked why MAGA doesn't like the idea of universal health care. I did a video reply to that message, and in the comment section of that video, this person says because it's inefficient, stupid, costly, and provides substandard outcomes, all of which are untrue. The U.S. for profit health.
So I'm an American moving to London, and I am going to expose the U.S. healthcare system and the insurance system. It's about 370,000 people file bankruptcy every year because they can't afford their medical bills.
Really?
Now, about 75% of those people have private medical insurance. So how does that happen? Well, I'll show you. This is an actual bill that a family received for reviving their newborn baby. And they had private insurance. So how does the U.S. system actually work? It's the complete reverse opposite to the U.K. You guys have the NHS, and then if you can afford private insurance, you go and you buy that in the private market. Or maybe your employer provides it. But at the end of the day, you have the NHS as a backstop. In the U.S., our first line of defense is private insurance, and then a really horrible public system baked underneath. So let's talk about the fine print. In the private world, you have in-network versus out-of-network. So if you go to the emergency room, if you need surgery, if you're delivering a baby, the hospital you go to might be in network. But if the surgeon is out of network, the anesthesiologist, the radiologist, if they are not in network, you will get a letter in the mail saying your insurance company is denying the medical claim. So that visit that was supposed to cost a couple $1,000s is now $30,000, $40,000, $50,000. Like, people in the US literally have a medical budget to have a child. All right, now let's talk about deductibles. The deductible is the amount of money you have to pay out of pocket first before your insurance kicks in. So let's say your deductible is $2,000. You go to the doctor for a checkup, that's a couple $100. You need to do a blood panel, that's another couple $100. Something's not right, you need an EKG. That's another couple $100. You have to pay for all that out of pocket because you did not hit your $2,000 deductible. It's only until you hit that deductible that your insurance company will start paying a percentage of the medical bill, sometimes like 80%. This is why the number one cause of bankruptcy in the United States are medical bills. So what happens when you can't pay the bill? Hospital sells that debt off to the highest bidding collection agency. They come after you for the debt. The hospital writes that off as a loss and then applies for a government subsidy saying we've lost money. And the government gives it to them because they can't afford to have hospitals shutting down. Oh yeah, and by the way, when you file bankruptcy, it doesn't get rid of your student loan, so you still got to pay that back. Yet you're financially ruined for the next several years. I haven't even gotten into prescriptions. Now, our public care has two components, Medicare and Medicaid. You only qualify for Medicare if you're older, and you only qualify for Medicaid if you basically have no money. So it's very common for staff to walk into hospital rooms and say, hey, your insurance company's no longer paying the bill. How would you like to pay? Do you want to pull money out of your retirement plan? Do you have equity in your home? Can you borrow money from family and friends? By the way, if you have all these options, you will not qualify for Medicaid because the government requires you to spend down your assets. And God forbid you need long-term care. Say you have a medical condition that's going to put you out for longer than 12 months, Medicare, Medicaid, and private insurance won't pay for it. So now you need another type of insurance called long-term care. Average cost of a long-term care facility in the United States is over $100,000 a year. So again, broke or not, doesn't matter. Private insurance or not, doesn't matter. Go to the hospital, can't pay the bill. Hospital sells off the debt. They report the sell-off as a loss, and they get subsidized by the government. Meanwhile, you're stuck with a bill and a collection agency that won't stop calling you. I love America. I do. And I hear a lot of people on this side of the world talking about moving there.
I just had a patient tell me that him and his wife got quoted $30,000 to go through IVF treatment here in the United States. So instead, they are flying to Spain, staying for 2 weeks, making it a vacation, and doing IVF, all for $15,000. And keep in mind, he has insurance here in the United States, so that was with his insurance. And they don't have insurance. This is just out of pocket. So the out-of-pocket cost there, altogether, the trip, everything, $15,000. Make that make sense. Like, why? How? What is going on here? Healthcare just shouldn't be this inaccessible and inexpensive, especially.
This is shocking and is a reality of life. This is an American guy based in the UK comparing the healthcare system in America and that of UK. How it is very easy for you to access a healthcare in UK more than America. Make this to make sense. An American coming out to say the truth. After moving from America to UK, he has come out to let the world to know that, oh, we in America are paying through our nose for medical care. Why in the UK it is way cheaper. Then the second lady is trying to say that her friend went for an IVF, that she was charged 300 and something thousand USD. She flew to Spain and everything she spent is around 15,000 USD. Make that to make sense. That is to say, Americans are paying through their nose to access a healthcare system. So, guys, and many MAGAs are out there still campaigning, clapping hands for Donald Trump for even cutting the Medicare and making Americans to pay through their nose before they could access a medical care. So, guys, keep on watching.
Somebody asked why MAGA doesn't like the idea of universal health care. I did a video reply to that message, and in the comment section of that video, this person says because it's inefficient, stupid, costly, and provides substandard outcomes, all of which are untrue. The U.S. for-profit healthcare system costs over $12,000 to $14,000 per person annually. It is the highest per capita spending in the world, while universal healthcare systems in other wealthy nations typically cost half that per person, about $5,000 to $8,000. Stupid costly is what we have here. It's stupid and it's costly. Additionally, universal healthcare systems consistently achieve better population health outcomes, such as higher life expectancy and lower infant mortality, at a substantially lower cost per person than the U.S. for-profit system. So the part about getting substandard outcomes is also a flat-out lie. Let me just pause showing you data for a moment to explain why they're able to do that. Because universal healthcare systems take a proactive approach to healthcare nationwide as opposed to a reactive approach to healthcare. In the United States of America, we say, eat that, smoke that, do that, doesn't matter, we got a pill. When you get this disease, when you get that, when you do that, when this happens to you, we'll fix it. Don't worry about it. Over there, they're trying to teach you to live healthier through the healthcare system so that you do not cost the healthcare system as much money and you have better healthcare outcomes. So that's two things that you said that were blatantly untrue. Now let's deal with the inefficient part. Universal healthcare systems generally feature longer wait times for non-emergency elective specialist care and surgeries compared to the U.S. However, the U.S. often matches or performs worse on wait times for routine doctor appointments, and U.S. data is frequently skewed by uninsured patients delaying necessary care due to high costs. It's really not more inefficient than our system. It truly isn't. If you actually know people who live in countries that have universal health care and you talk to them, they're going to explain to you how absolutely untrue everything that you just laid bare is. It's all propaganda that's being pushed by right-wing politicians in this country in order to continue to keep the for-profit healthcare system in place. You are literally advocating to pay double what other countries pay for healthcare, get worse outcomes, and have, generally speaking, the same amount of wait time. Why? Why do you want to pay more? Aren't you pissed off at the money that you already give to the health insurance companies just to be able to have access to healthcare? Aren't you pissed off at your premiums and your deductibles? That's not pissing you off yet, man. They are convincing you to advocate for you to spend more of your money to get worse healthcare outcomes, and you're falling for it.
All right, if you are here from my previous video talking about the linkage between autism and vaccines and how there actually is none, where I cite multiple studies, welcome. I'm going to break down the executive order delivering gold standard childhood vaccine recommendations for Americans signed by the president yesterday. There is no serious scientist or physician who stands behind these recommendations because they weren't based in science. First of all, in this first paragraph, it says that the United States currently recommends more childhood vaccines than any peer nation. First of all, Europe has free health care. Okay? They're not worried about insurance. They're not worried about paying out of pocket And they're not worried about how many doctor's visits they have to go to because, unlike the United States, they don't get charged every time. So, the recommendation to break up vaccines, which is not grounded in science whatsoever, lots of our European peers do hexavalent vaccines, not trivalent. They do 6 vaccines at once in one shot, not 3 like MMR. But Trump is saying MMR now has to be broken up with no scientific evidence, which means that parents are going to have to pay a lot more money for every doctor's visit they go to try to get their children fully vaccinated against these illnesses that can be deadly or cause lifelong issues, such as, I don't know, mumps can cause little boys to be sterile for the rest of their lives. So by removing recommendations and making it shared clinical decision making and breaking up vaccines, parents and families with more than 1 or 2 kids, you are going to be out thousands of dollars more if you want your children to be vaccinated. That is a barrier that a lot of people cannot overcome. Their children will get sicker and their children may die more often, thanks to Trump's recommendations. I was also saying that because of this executive order, we're more in line with other European countries per their vaccination recommendations and number of vaccines given. I'm going to read you a list of countries that have more vaccines than what Trump is recommending, okay? List of European countries that he's calling our peers: France, Germany, Switzerland, Sweden, Norway, Finland, Italy, the Netherlands, Austria, Greece, Belgium, Portugal, Spain, the UK, including England, and Northern Ireland. Have more vaccines recommended now than what we do in the United States. The only country that has one less vaccine recommended is Denmark. Denmark, with less than a population of LA County, full universal health care where the parents don't have to worry about the vaccines, and the vaccines are still available. 20 major developed countries around the world recommend MMR as a trivalent vaccine, which Trump wants to break up. How is that on par with our peers? What else Trump removed from the vaccine schedule? Meningitis. Someone I grew up with in high school died from meningitis her first year in college. Longer recommending Hep A, influenza, COVID-19. And you may think, oh, COVID is just the flu. You may want to try to argue with me about that. Little kids who get SARS-CoV-2, they develop diabetes type 1 that is lifelong at a higher rate than children who do not get SARS-CoV-2, and vaccines can protect from that massive inflammatory response. We're suddenly in the minority in terms of the vaccines we're recommending, and these diseases can be deadly. Talk to your child.
Like I said before, Trump voters can go any length to make sure they just keep on defending him. Also, as I said before, for you to keep on supporting Donald Trump, you must not be normal. Because a normal person can't just keep supporting Donald Trump. They must always find a reason, something to say in order to support Donald Trump. Look at what this man said here. According to the post he posted earlier, someone said, because it's inefficient, stupid, costly, and provide substandard outcome. That is, this person is talking about universal health care is substandard and is and it and it is stupid expensive. That is to say, they do not want free medical care. You get? MAGAs are trying at all costs to make sure they defend Donald Trump, to make sure they bring up a reason to back up their claims. They are saying that standard health care, having access to free medical care, that it is expensive on the citizens who are funding it. Omo, MAGAs, una too sabi. Guys, based on all this controversy, all this back and forth, based on how MAGAs are coming out with full force to defend every mistake of Donald Trump, what is your take about all this stuff? Because people keep on comparing Europe medical access and also the access of citizens in America to medical care. So share with us your own view at the comment section. What is your own take? Are you supporting Trump or are you against him? Do you want free access to medical care in America or you do not want it? This is just me telling you to share with us your honest opinion at the comment section. And as you do so, may God bless you. Don't forget, for more interesting updates, please do well to subscribe and turn on your bell notification. God bless you guys for watching and bye for now.